Welcome back. So around the country, young people are now preparing to go back to campuses next year, with some preparing to go to a higher education campus for the first time. The 2022 academic year, of course, suddenly approaching. Dr. Ramnik Ahluwalia is the CEO of Higher Health. Dr. Ahluwalia, good afternoon to you, and I thank you for your time. At this stage, are you expecting most campuses to actually be taking students onto campus for face-to-face teaching next year?
Yes, absolutely. Steve, we've done some modeling work, and with the SA Modeling Consortium and National Institute of Communicable Diseases, understanding the fourth wave in reality and the COVID challenge that we are seeing. And what we have seen now is, with the scenarios, that definitely the fourth wave will certainly not be at the level we experienced as a brutal second or third waves. Irrespective, we have put some protocols, irrespective when we were last year in January and February, despite we had a second wave, we gradually still, through the protocols, opened our campuses. So we are very confident. We are going with the notion of opening our campuses. In fact, all universities and all TVET colleges and community colleges, we will still follow the protocols, which are very intense towards how many students will enter, how they will enter, and the whole system of screening and testing that happens through the whole process, including the residence program protocols. But we are very determined, and with the modeling work we've seen from the fourth wave, the predictions, we definitely do not expect a brutal fourth wave or a fourth wave even close to what we experienced second, third wave, which means that our lockdown levels will be far more relaxed compared to what we experienced after the festive season. And that gives us more confidence of opening our campuses.
I mean, one of the things about opening campuses, especially at the start of an academic year, is that you've got lots of young people coming from different places all over the country coming together. I mean, that could lead to cases and transmissions. That will be the risk.
Definitely, Steve. It does depend on how our population will take the vaccination program seriously or not. As I spoke previously also, we have close to about 36% of our student population vaccinated already. And that's our data suggesting to us. If not, in the next 2 weeks, we should be completing, because they are already enrolled in the project. We have this very sensitive next middle one-third population, Steve. This middle one-third population wants to get vaccinated. And through your channel and to the parents that are listening, to the students that are listening, I'm appealing that after this exams, you will go home. You will be in your safe places. But find a nearest vaccination site and do get vaccinated for those middle one-third and the last one-third who are not vaccinated. So the middle one-third wants to get vaccinated, have given us positive results. They have questions, they're waiting, they are discussing, they're interrogating, but they've shown a very positive side towards pro-vaccination. And if we can get that population vaccinated, then we have a close to about 70%, and that's what we're hoping by the campuses opening in January 15, that we will reach around 70% of our population, student community vaccinated, which will further reduce enormous burden of the spread of people coming from different homes after the festive season, carrying the virus together. Because what we have seen from the science is that when you're vaccinated or completely vaccinated, your viral load tends to be low, because once the virus enters, including the new mutants that we are seeing and the affinity to the youth, as well as the binding capacity to the cell, as well as the high transmission rates that we see due to high replication, the body, through the vaccine immune system, overcomes the virus transmission very quickly, which means the transmissibility is comparatively far lower to the people who are not vaccinated, despite the whole hospital trends of admissions and deaths. So these are other preventive things that comes along with the vaccination as a package. And that's why the fourth wave seems to be far less brutal, because our population is vaccinating and is going to get vaccinated. So this will help us open our campuses far more safely if the trend continues the way we're expecting our middle one-third to vaccinate, to get us to the to the 70% of our population very quickly.
I mean, there's a lot to talk about as well as into how to manage the disease. In other words, I would imagine most organizations, most institutions that you work with have just got a lot better at managing the disease in the first place. You know exactly what protocols to follow, what to do if there's a case. All of these things have got a lot easier than they were. I mean, 2 years ago, 18 months ago, no one really knew anything. We know a lot more now.
In fact, this COVID and the vaccines and the virus itself, I think it's because of the resources that the whole world at one time had no clue of what to do. So they pumped so many resources that the scientists got so much of power to decode this virus, to understand the virus in details in such a short space. In fact, today, last year, if you would have interviewed me, Steve, I would have not even be able to get you what looks for the next 2 weeks. We were not sure about how the mutations are happening, how this virus enjoys the human body, how it mutates, what kind of mutation we're expecting, when the wave will be expected. But sitting today in a year time from now, we actually know everything about this virus, not everything, but a lot about it. Still, predictability cannot be 100% because the virus sometimes tends to be over clever than the human brain. But at this moment, the human brain is overpowering the virus. So we can see how this virus is now going to behave when it comes to 2022. We can plan academic years far better. We exactly know what to do. But what will limit us is still the human behavior. And the human behavior is something, irrespective, we were 2 years back to now, we will never be able to overcome anything of the human behavior. It applies to HIV, it applies to mental health, it applies to gender-based violence, it applies to everything. And it applies seriously to COVID. And human behavior will decide the fate, how this COVID will go despite we having the vaccine. The human behavior is about getting the vaccine or not. Human behavior is about we will maintain the social distance. Human behavior will be, can we still wear the mask despite being vaccinated so that those non-vaccinated can be prevented, and how we tame this virus. Because if we do not allow this virus to move from one body to the other, the virus will not mutate, the virus will not move, and the chain of the cycle will be broken.
Within all of this, I mean, there's a lot to sort of look at with what's going to happen in the future, but there's also the question of whether there'll be disruptions, but also the question of online education. A lot of people thought that higher education might just move online. It doesn't seem that that's the case. Do you think people want to come back onto campus? I realize, you know, you're the CEO of Higher Health. You're not in charge of online education. That's a different thing. But do you think people want to come back to campus?
In fact, we've done a lot of surveys, Steve. In fact, Higher Health has been in the forefront in understanding the scourge of the COVID on the student community and the teaching and learning aspect. And the first thing that came out is real. That is, our universities are not so we have UNISA for a reason. We can't have everything UNISA, which is online. You can't teach medicine, engineering, fishery, mining, vocational trainings online. It's practically impossible. Parents are asking, the universities, parents are asking institutions of higher learning. We give you a fees for a reason to build an economy from our students by building a proper skill set up into them. The whole competency, if we are looking at our economic growth as a country, we're expecting China, United States, Germany, and every other world to invest in South Africa. We need to give skills to them to compete into that environment so that we can grow the industries and grow the economy. That is not going to happen online. Hybrid, yes. But in hybrid, there will be a mechanism where we need to transition from a 70% online due to COVID back to 30% online, but still 70% contact. Study time is compromised. Mental stresses are growing for people sitting alone and trying to figure out what education should be. So there is definitely, irrespective, we have learned enormous technology, and hybrid mechanisms might be the way forward in the future, but you cannot replace contact skills building to an online skills building. And that's clear from the scientific data, that's clear from the students, parent bodies. And I think we have to, and that is exactly how we have to start living with this virus and start